Hello, and welcome to the final Yoga for People in Pain webinar. Today, as promised, we're going to start doing some gentle yoga practices. Also, as promised, we're going to have a chance to integrate the breath awareness, the breath control, the body awareness, and the work we've been doing on trying to decrease body tension. So we want to try to integrate those sorts of things into some very gentle yoga. Now, you all know that it's hard to move in the face of pain. So we want to start with some guidelines, and I thought I'd show you some, give you a little bit of visuals to help with understanding these guidelines that we're going to use as we start to do some yoga. So to try to explain the whole pain thing, now some of you have heard this story before, but I'll try to explain this. So before you started to have pain or chronic pain, this blue line here is to show that your body could tolerate a lot of force before it would be damaged. And that's just the way that our bodies are. Now, before we had pain, it took a lot to get your alarm system to go off, or a lot for your pain system to tell you that there was a problem. So typically when you move, before there's a chronic pain condition, you put force on your body and you put more and more force, and at some point the alarm comes on, and it's usually the alarm comes on shortly before you're going to injure your body. So take, for instance, if I were to take my wrist and I pull my wrist back really far, there's a point where as I do this, it'll actually start to hurt. Now the pain's going to start just before I'm going to damage my body. But if you can imagine that if I've injured my wrist, if there's something wrong inside my wrist and the nervous system there has gotten really sensitive, now when I pull my wrist back, I won't be able to pull it back as far, and the alarm system is probably going to go on much sooner now than it ever did before. So we can try to show this to you in a visual. So once again, here, this is what things were like before you had chronic pain, and now things have changed because you've been less active, because the tissue was injured. The body isn't able to tolerate as much force now before it would be injured more. So the blue line now of how much your body can tolerate is less. You can also see on here that the alarm is much lower now. Over here it was very close to where the damage would happen. Now the alarm gets louder a long time before your body would even be damaged. Now, this tells us that what we need to do around trying to move in the face of pain is, or maybe I should start with what we shouldn't do. What we know is that if you only exercise down here, if you only exercise down here where you never get up to where you challenge the alarm, we know that people don't get better. We also know that if people push past this line, if they push past this red line, what usually happens is that people's alarm system gets even louder. It starts to act as if you're not listening. And we don't want to do that over and over and over again, because when we do that over and over again, it makes the alarm system louder. So what we want to do is not hypersensitize the system even more. We want to try to find a way when we exercise in the face of pain to go right there, to exercise right at that spot where the alarm is gone on just a little bit louder. So there's just a little bit more pain than there is normal. So with all of the yoga postures that you're going to be doing, what I want you to try to do is move to a spot where there's just a little bit more pain. And now how much more pain is okay for you is really going to be dependent on yourself. But then when you move to that spot to follow the guidelines, what we need to do is you need to ask yourself a couple questions. All right? So there's two questions we want you to ask. The first question is this: is this really dangerous? So if I were to pull my wrist back and I start to feel more pain, I need to decide, if I keep on doing this, will I cause more damage to my body? So is this movement really dangerous to my physical body? And if you were to say, no, this is not really dangerous to my physical body, then it's an okay movement to stick with. If you're feeling it's dangerous, you need to back up and not push so far. The second question you need to ask yourself is a really important one, and it's this: will I regret this later? Or will I pay for this later, if you want to think of it that way? So we want you to move to a spot where there's a little bit more pain, where you feel safe, and where you're saying, yeah, I know there's a little bit more pain here, but I know I'm not going to pay for it a big amount later on. It's really, really important that you start with those. Then it gets more complex. So the first two aspects of the guidelines you want to follow are to move to the edge of the pain and then ask yourself those two questions. The next step is to, while you're there, you need to stay at the edge of the pain. So you're going to move to a spot where there's a little bit more pain. Don't run away from it. Don't push too far into it. Just move up to that spot where there's a little bit more pain. And people often call it the edge. So while you do that, when you're at that spot, what you want to try to do is this. Do your best to keep your breath calm. What typically happens when we feel more pain is as soon as you feel more pain, you'll hold your breath, or your breath starts to get shallow or it gets ragged. So what you want to do is move to the edge of the pain and do your best to keep your breath calm. Then the other thing you need to do while you're there is you need to work on keeping your body tension calm. So do your best when you push into that edge of that pain is figure out, can I stay here and keep my body tension calm? So you want to find that just right spot. Now you need to do one more thing. So you're there at the edge of the pain. You've answered the questions, yes, and I believe it's safe, and no, I don't think I'm going to really pay for it later. And you're doing your best to keep your breath calm. You're doing your best to keep your body tension calm. The other thing that we think you should do is this, and this can be really, really hard. It's monitor the pain. We'd like you to try to see if you can pay some attention to the pain. Not too much and not too little. It's a little bit like that Goldilocks story of that just right amount. So you may check in with the pain every 10 breaths. You may check in with the pain every minute, but every once in a while you need to come back and see how the pain's doing, because we know that if you completely ignore the pain, for a lot of us that just doesn't work. So these are the guidelines. You go to the edge of the pain, you ask yourself, is this safe? Will I regret this later? And then while you're there, you try to keep your breath calm, you try to keep your body calm, and every once in a while you check in to make sure the pain's not getting too much. And if you find you can't keep your breath calm or your body calm, or that the pain's starting to build up, you need to ask yourself those questions again. Will I regret this later if I keep on? And if you say, well, maybe I might, then back up just a bit. Don't push quite so hard. Find that spot where you're just doing a little bit less, where you can do a better job of keeping your breath calm and your body calm. It's a lot to remember. I'm going to try to remind you over and over as we go through this practice today. So in a moment, what I want you to do is to find a really good position sitting. So find a place where you can sit. So I'm just going to shift my position around here, and you shift your position around. And what we'll do is we'll get to a spot where we are sitting in a comfortable position. Okay, so now we found a nice, comfortable seated position. I'd like you to feel your feet resting on the floor. I'd like to feel your spine reaching a little bit tall, and see if you can let your shoulders relax a bit. And let's take your awareness to your breath. Start to make your breath a little bit longer, make your breath a little bit softer, make your breath a little bit calmer. As you breathe out next time, take your right ear down towards your right shoulder. See if you can find that just right spot. Find that edge of the pain. And once you get to the edge, ask yourself, is this safe? Will I pay for it later? Be in that place where you can breathe calmly and keep your body tension low. Next time you breathe in, bring your head back to the center. As you breathe out next time, take your head down to the other shoulder. Keep your breath long and calm. Keep your body tension as low as you can. And challenge the edge of the pain. Just give it a little bit of a nudge. The muscles to the sides of your neck are going to be tight as you do this. See if you can keep them calm. Next time you breathe in, bring your head back up to the center. Now we're going to do a twist. So turn your shoulders and your ribs towards the right side. Now you're going to turn your neck as well. Just for a moment, I'll keep my neck towards you. Turn and look over top of your right shoulder. Pull your ribs and your shoulders around. As you breathe in, feel your spine get really tall. Soften as you breathe out. Try to allow yourself to come into a bit more twist. The next time you breathe in, come on back to the center again. And then twist to the other side. Now find that just right spot. Find a spot where you say, that's enough. If I go any further, I'm going to pay for it. If I go further, I may not feel safe anymore. And while you're there, breathe calmly. Get as least amount of body tension as you can. Stay in touch with the pain just a bit. As you breathe out next time, come on back to the middle. Now just try those twists once again. So go over towards the right, find that edge of the pain. Let your head relax, looking over your shoulder. Calm breath, calm body. Stay at the edge. And then come on back to the center. Do the other side. Twist around to the side. Find the edge. Stay and breathe. Calm your breath. Calm your body. Stay in the place you know is safe. And then when you breathe out next time, come on back to the center. Feel your feet on the floor. Feel your spine really tall. Shoulders relaxed down. And then bring your chin down towards your chest and let your body slump. So round your body so you come forward. And when you breathe in again, come on back up. But as you come up, try to lift your chest. Try to pull your shoulders back, lift your chin up. And as you breathe out, go on back down again. Now you just move to the spot. The just right spot where there's a little bit more pain. Each direction. Find the edge. If you get to a spot where you can't breathe, then it's time to come back the opposite direction. If you find your body tension getting really tight, it's time to come back away. That's the edge. It's far enough for now. Keep on challenging it gently. You'll be able to go further in time. Just go down one more time. Just to that right spot. When you breathe back in again, come on back up. Just come back up to a neutral place. Now next time you breathe in, lift your shoulder blades up towards your ears. And when you breathe out, let them come on back down. And when you breathe in, take them up towards your ears. And when you breathe out, let them relax back down. Breathe in, lift them up. Breathe out, relax them down. And make a change here. Lift your shoulders back up as you breathe in. When you breathe out, pull them down. Try to pull them down your back. When you breathe in, take them back up. When you breathe out, pull them down. But you're still just going to your edge, just to that just right spot for you. So pull them back down again. Now switch back to the first again. Breathe in, lift them up. Breathe out, let them relax. Breathe in, lift them up. Breathe out, let them relax. One more time. Breathe in, lift them up. Breathe out, let them relax. Put your hands on your hips. Try to pull your shoulder blades back a bit if you can. Elbows back a bit. Lift your chin just a bit. Now next time you breathe in, puff up your chest. Pull your shoulder blades back. Push your chest forward. Lift your chin up just a bit. And as you breathe out, let it relax. And when you breathe in, puff out your ribs, lift your chest, pull your shoulders and elbows back, chin up. As you breathe out, relax. Just do this a few more times. Lift up, pull back, just to the edge each direction. Don't go through it. Make sure you still feel safe. Make sure you know you're not going to regret it later. And come on back to a neutral position for a moment. If you find your shoulders are tight and you want to stay with doing this, stay here. But if you have more movement, put your hands behind your back. Grab one wrist with the other hand. Pull your shoulders down. And next time you breathe in, lift up your chest, lift up your ribs, pull your shoulders up, lift your chin up. And find a place where you can stay for a few breaths. If you have your hands on your hips, pull your shoulders back and elbows back, lift your chin just a bit. Find a place to stay for a few breaths. You'll want to make sure you're at that just right spot. Now as you breathe out next time, release the tension, release your arms, bring them back around. Now your shoulders might feel tight, you might feel good just relaxing and just shaking yourself around, or maybe moving your neck and your spine around a bit. As we keep on going through the practice, if you say that's enough, if you find you're at the spot where you're feeling, if I continue, I'm going to regret this, then just stop here. If you do stop the movements, what I'd like you to do is try imagining them. Try imagining that you're continuing doing these. This is still going to give you some benefit. So once again, feel your feet on the floor, feel your spine really long, let your shoulders relax. And next time you breathe in, take your right arm and lift it straight up towards the sky. And as you breathe out, bend over towards the left side. As you breathe back in again, come on back up. And as you breathe out, let your arm come on back down to your leg. Next time you breathe in, left arm goes straight up. Lift your spine, lift your arm, and as you breathe out, side bend down towards the right side. When you breathe back in again, come on back up. And when you breathe out, your arm comes down. So the idea here is to move with your breath. Only go to the edge of the pain. Give it a little bit of a nudge. Keep breathing. Come on back up. Let your arm back down again. Breathe in, lift up. Breathe out, side bend. Just going to do one more with each arm. So next time you breathe in, right arm goes up. You breathe out, bend down towards the side. Breathe in, come on back up. Breathe out, arm comes down. One more time, left arm goes up. Then down towards the right. Come on back up. Let your arms come down. Now what we're going to do is move into a forward bend. So keep your hands on your thighs or your knees. Let your chin come down towards your chest, round your back, and bend down into a forward bend. When you breathe back in again, push yourself back up. Come on back up to a sitting tall position, and when you breathe out, let yourself round down, round your back, bring your chin down. And breathe in, push yourself back up again. And one more time, go down with your breath. Breathe out, go down into a forward bend. Breathe in, come on back up. Now when you go down next time, go down as far as you feel comfortable going. Find that right edge. Now if you need to go further, put your hands down between your legs and come on down all the way. You find the right spot for you. So go to the edge. Bend forward. If you need to keep your hands on your legs to feel safe, do that. Go down to a spot where you find that edge of the increased pain. Breathe gently there. Calm your breath, calm your body, and stay at the edge. If it softens as you stay there, allow yourself to go further. If it starts to get tighter, then come on back up. Now next time you breathe in, push yourself back up or walk your hands back up your legs so they're all the way up. And once you get here, lift both hands up if your shoulders will allow you. Lift them up towards the sky as you breathe in. As you breathe out, let your arms come on back down, and do this for a few breaths. Each time you breathe in, your arms go up, your spine lifts, go up to where you say, that's just the right amount of lifting, that's far enough. And when you breathe out, come on back down. Breathe in, lift. If you can this time, stay for a few breaths. Reach with your spine, push your feet to the floor, reach your fingertips to the sky, and breathe. Try to let go of tension you don't need. Try to challenge the edge to just right enough. And when you breathe out, let your arms come on down to your thighs again. If your body's feeling tight, if it needs you to move around, move it around. If your neck needs some movement, if your arms need movement, give them a bit of a shake. Now is the time for some relaxation. So I want you to sit back to the back of the chair with your spine tall if you're there. Feel your feet on the ground again, feel your spine tall, feel your shoulders relax down. Bring your awareness back to your breath. Try to make your breath longer and calmer and smoother again. And see if you can create a sensation of lightness in your body. Like your arms are lighter than usual, your legs are lighter than usual, your torso is lighter than usual, your head and your neck are all lighter. Like each time you breathe in, your body is going to lift up just a bit, becoming lighter. And then see if you can create a sensation of gentle warmth in your body. Maybe you can feel it spreading from your torso, through your chest, through your arms, down to your hands, through your pelvis and legs, to your feet. A sense of warmth through your neck and to your head. Or maybe you can feel it expanding with your breath. Each time you breathe in, it spreads out a bit further. But along with that sensation of lightness, create a sensation of warmth. And then imagine a sensation of peacefulness around your heart. Each time you breathe in, you can feel a little bit more peacefulness. And it starts to spread through your body. You can feel the peacefulness of your breath. You can feel a sense of peacefulness expanding down your arms to your hands, through your ribs and belly, your pelvis and legs and feet. A sense of peacefulness through your neck and your head. So your breath is feeling more peaceful, your body is feeling more peaceful, and now your mind is too. Stay here for 20 more long, calm breaths. Come back to practice this 2 or 3 or 4 or 5 times a day. You decide what feels like the safe amount, the right amount to do. Give it time. The positive effects will happen with practice, with patience, with persistence, and with compassion.